So this thing is called a Jada, and as a high-risk labor and delivery nurse, it is my favorite tool we utilize if a patient starts hemorrhaging after giving birth. So imagine this is your uterus. After giving birth, your uterus, which is actually a muscle, should flex and contract, which will slow bleeding down and help prevent a postpartum hemorrhage. If the uterus does not contract, this is called uterine atony, and it is responsible for up to 80% of postpartum hemorrhages. So the Jada is a device that we can place inside the uterus to help stimulate contraction. The Jada is soft, flexible, and at the end of this loop, you can see tubing with holes. And what happens is we place that loop through the cervix and into the lower uterine segment. And this green wrinkly piece is actually a deflated balloon that butts up against the cervix. We then inflate that balloon with sterile fluid, and that inflated balloon creates a nice tight seal against the cervix, ensuring good suction. When the Jada is in place, you can see that the bottom of it has an adapter so we can connect it to suction and create a vacuum effect. And as you can see, it causes the uterus to collapse in on itself and stimulate contractions to manage the bleeding. Studies showed that real-world use, the Jada is about 93% effective at managing postpartum hemorrhages. And as a nurse, one of my favorite features is that we encourage short-term use of the Jada, meaning after only an hour of placement, we can disconnect the suction and see if the patient's bleeding is stable. And in the majority of cases, it is shown that the Jada can be removed within about 3 hours after placement, which has so many benefits such as patient comfort, patient mobility, and reducing the risk of infection, just to name a few. We've used the Jada where I work for about 5 or 6 years, and I absolutely love it. Follow for more.